There's a stat that says 94% of healthcare organizations already view AI as a core to their operations. It's not just about being modern. This is about solving real world problems using technology that's readily available for everybody. Ronald M. Razmi, author of AI Doctor, says AI is a solution enhancing every stage of patient care, from research and discovery to diagnosis and therapy session. As a result, clinical practices will become more efficient, convenient, and personalized, as well as effective. So this is something that you have to step on. This is just not a future trend. This is the actual present reality. There's a saying that says the future is already here, it's just not evenly distributed. This is where you can take advantage of that. First, the need for human scribes. 25% of the day is just lost to just this documentation. That's a serious problem. The second one, front desk, they're just overwhelmed with call spikes and just the need for insurance checks. This absolutely leads to no-shows from patients and just overtime pay that drives up the cost of your daily operations. The third problem, if you have a biller in-house, I can guarantee that they just can't keep up with the pace of billing rules and all the different things they have to do, and especially with the denial rate for medical billing reaching all-time highs of 11%. You're running into more and more issues with your in-house biller dealing with that. Fourth, nursing staff is very limited. They have no way to capture high quality patient summaries and histories, and they don't really know effective ways to triage patients in certain scenarios. And last but not least, as your medical practice is aware, you have all these quality metrics that you have to collect, but you have no population health department. So you're running risk of missing out on huge incentive payments. Let me ask, do any of those 5 resonate with you? So here's a clear action step for you today. Just identify your biggest pain point. Is it administrative overload, diagnostic delays, patient scheduling? Write down 1 or 2 areas where your practice is struggling the most, and this will be your first target for AI implementation. Look, don't try to solve everything at once. Just get started with your greatest need, which is absolutely probably going to cost you the most. Healthcare's most costly and overlooked problems tend to be around patient compliance. There are estimates that say patient noncompliance in the United States alone costs at least $100 billion annually, and likely 300 to 500 billion when considering other social economic impacts. Today's patients can absolutely move from apathy to automatic with these AI secrets that can really transform their lives. My name is Theo Harvey, and I'm a serial entrepreneur who went from lowly employee to a CEO who runs a remote multi-million-dollar healthcare startup from his home. I raised over $1 million from venture capitalists and other investors, and I work with large organizations like Cisco Systems, AT&T, the Charles Barkley Organization, and Blue Cross Blue Shield. My mission is to help healthcare professionals prepare for the new normal in healthcare before it's too late. AI is great, but using it out of the box is not wise in healthcare. Why is that? Well, there are multiple things that can go wrong with it. One is a process called hallucination. This is where the artificial intelligence just makes up things, right? Just makes up steps, makes up ideas. And a lot of times you have to understand how it can get through that process without messing up. And healthcare is so important that you have to be clear, because if you're not clear and getting a process started or any type of operations, people could get hurt seriously. Here's a fun fact. You can see this in action next time you do a prompt on ChatGPT. After you get your answer, put in this exact phrase: "Can you please check your answer?" I can tell you right now, you will be amazed about what it comes back with. I've done that multiple times before. So check that out. Let me know if that works for you. This is a quote by Sam Altman, CEO of OpenAI. He said, "The thing that I try to caution people the most is what we call the hallucinations problem. Model will confidently state things as if they were facts that are entirely made up." So you want to be careful about that. So I would recommend not using artificial intelligence or AI for use for clinical decision making or diagnoses. But we do want to utilize it to encourage patients to take their medications, remember their appointments, or general engagement with doctor instruction. It tends to work great that way. You can change behavior with personalized AI messaging, in our opinion, based on the studies, but also on what we've thought about using AI. So that's kind of what we thought about. We weren't looking at artificial intelligence to change diagnoses or to help with patient awareness. Really, it was about getting patients to change their behavior so they can make appointments, get their medications done, things like that, because that's the key. We think is really changing behavior, because healthcare is really self-managed a lot of times, right? Patients just don't listen to what the doctor says to do those preventative things that we all know that they need to do. And so that's kind of how we thought about it first, right? Simon Sinek says, when you know your why, you'll know your way. And I believe that's so true. Why are people turning to AI for therapy help? And I think there are three main reasons. The three areas are, number one, they need access, emotional safety, and anonymity. Access. What does that mean? We live a 24/7 society, so people want access to these tools when they need it. What does ChatGPT and other AI-based chat tools give you? Accessibility. I can go to it right now and type in anything I want to get information. Number two, global outreach. Imagine that you are in a rural area of India or areas that getting mental health professionals is just unheard of. You can go on ChatGPT and ask it a question to help you with something and feel connected unlike before. Global reach is so important when it comes to therapies and mental health benefits. Finally, scalability, right? You want to be able to have quick responses, fast responses, right? You don't want to sit there and get the little pinwheel deaf, right? When you're talking to someone or someone not responding to you right away. Scalability is so key because now these tools can talk to millions of people at the same time. When you look at accessibility when it comes to mental health tools. Matter of fact, there's a statistic that says for every mental health professional, there are at least 1,600 people that need their services. So I think it's so important that having access for mental health and behavioral issues is so very important for people here in 2025 when there's so much that people have anxiety about and issues about. And AI gives them a window into what people are yearning for. Emotional safety and non-judgment is another key reason why people are turning to AI. Non-judgmental environment is basically looking for a human not to judge you on your deepest, darkest fears or concerns or thoughts. You don't want to have someone judging you and thinking about you a different way and looking down on you. Well, AI never gives you that feeling. The way it's programmed is very chipper, communicates to you in an effective manner. It doesn't seem like it's judging you. And I think people like that. And also, you want to have anonymity. What does that mean? Just a fancy way of saying being anonymous or being something that is between you and someone else. AI gives a perception of anonymity, right? But as we all know, these tools are backed by large organizations that capture data. So just be careful. Tell your patients to be wary of giving all the information to AI systems when we know for a fact that sometimes these data, they can be breaches, they can be what they call public health information that can get out there unintended, but it can worsen the situation. And so definitely that is a perception that patients have. And that's why they're going to these tools. This is the ultimate test for any AI tool you consider. There's a statistics that says from AI multiple research that fewer than 30% of healthcare organizations have successfully integrated AI tools into their everyday clinical workflows. So why? Well, you know what? I think it's because new technology disrupts existing workflows sometimes instead of aligning with them. Let me say that again. Sometimes new technology disrupts existing processes and workflows instead of aligning with them. So here's a framework that you can absolutely take from me in order to get the alignment with your AI tools that you want to implement to solve real world problems. First, you want to start with the problem with the most pain. For example, if you have front desk staff that are overwhelmed by call spikes and repetitive insurance checks, you know it's the greatest pain because it's probably cost you the most, right? With no shows. Second, you want to pilot fast and measure. Yes, this is probably the opposite of healthcare, but you absolutely kind of want to move a little bit faster to determine, can you get a quick ROI, right? When you're about to do something, instead of taking time and effort, just say, hey, I want to implement something and see how fast does it save us in hours. So the example I used before, if you're using a tool that helps you with scheduling more effectively, using a vendor that not only uses AI, but actually has a human in the member to kind of track what's going on inside the tool and give you those metrics clearly, then you'll be able to kind of measure if you're getting the time savings. So basically hours saved from your staff because now scheduling is done automatically for you. That's another key point. You want to make sure any AI tool or technology you use, you want to have a human in the middle. You don't want artificial intelligence tools going off on their own, especially in healthcare. So making sure whatever vendor you work with, they have that man in the middle type of situation. Next, you want to make sure You empower a clinical champion because look, adoption rates increase when there's a peer inside the practice that actually is leading that change. What we've seen is that doesn't have to just be a physician or a nurse. It can actually be a front desk person or a tech savvy practice manager. But you definitely want someone that is really energetic because look, they can be the interface between the practice and the vendor, but they can also communicate areas of improvement from the practice back to the vendor and vice versa. And more importantly, can keep things on track because you have one person that's in charge, then typically that makes sure the project is moving forward in an effective fashion. Last but not least, you want to iterate quarterly. That means you want to constantly evaluate. You want to revisit templates, look at your rules, the scheduling rules that you set up for your patients to show up and making sure that you're still getting that same ROI every 90 days. But more importantly, you want to verify if this is something that you don't want to get locked into, right, with the vendor. So let me ask you a question. Do you see a problem currently that you're running in your medical practice that you're struggling to kind of even get started on how to use some of these tools? I think we can help. We just recently launched our newest guide that will walk you through each one of these steps that I went over today. And the best part is absolutely free. Look, simply go below to the link below, sensormed.com/AI-workflow to check out that guide and see if it can benefit you in your medical practice today.